Hi, I'm Dr. Irfan. I'm Dr. Amar, and we are periodontists in Southfield, Michigan. I think we actually have an example of a patient who came in who didn't have enough bone. And in that case, you'll see what the difference, because in this case, the patient simply did not have the bone, but very often they do. So can we show that case? This is the case. So unfortunately, sometimes people are afraid to come see us. People are afraid to have something done. And with sedation patients come in, we give them some medication, they go to sleep, and when they wake up, they're done. And so unfortunately, this is one of our patients. He avoided us for a long time. And when it was finally time, you can see he really had to come see us. And what we had to do is we took away all of that bad tissue, all that infection. When we were done, we had to utilize not just his teeth, but we had to replace some of his soft tissue. And that shows up in his teeth. And what's nice about this is when we put this in and he smiles, he's only really smiling. You only can see the teeth, but we did have to replace both the bone soft tissue and the teeth in this case. Now, if you were to come in and you had a lot of bone and you were to go to some place that doesn't do this type of procedure, you would have this no matter what. If you had a lot of bone, a lot of soft tissue, you may leave with this type of prosthesis. And unfortunately, we see that a lot. And if something happens over time, well, all that bone has been moved. And now it's hard to retreat these cases. To me, I was always taught save bone. You don't want to lose bone. I'm in the business of keeping the bone and growing the bone and in treating periodontal disease. But we can't always save the teeth. And when we can't save, the teeth implants are the best option. Sometimes it's one, sometimes it's a mouthful. And for this case, for instance, he came in, and if he was to go to some other places, you would see them remove all of his bone and bring these implants up. And so what we decided to do for him was to leave the tissue where it's at, and then beautiful. It's simply beautiful. I hate to interrupt you, but it is gorgeous. Yeah, this is his natural smile. He feels comfortable, confident with this when he's smiling. It's his teeth, it's his gums. And we haven't removed bone like you said. We really work hard to save bone. And that's not just with teeth. We're trying to do that for implants as well. And I feel very blessed to have as my partner, Doctor here, who I think is the best implant specialist in the state of Michigan and maybe in the country. He's absolutely amazing. He's been lecturing all over the country and internationally as well, talking about some of the new techniques that he is implementing here in our office. So if you have questions, if you have comments, there's a whole lot of things you may want to know. We'd love to hear from you. Subscribe to our YouTube channel. Have a great, great day. Restore your smile and your health. Visit dr.And.com to schedule your appointment today.